911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
So the typical dosing of pirfenidone is it's one capsule or tablet. It comes in those two different formulations, 3 times a day for a week, and then increase it to 2, 3 times a day for a week, and then increase it to 3 times a day going forward. There is a relatively new formulation which takes those 3 capsules or tablets and condenses them into 1 pill, and so it ultimately can be 1 tablet 3 times a day. So there are other dose escalation or initiation schedules that can be followed, and I commonly do this with my patients, which is really only increase the dose once the dose that they're currently on is being satisfactorily tolerated. So in other words, they're not having significant side effects. So what I'll do is 1 capsule or tab 3 times a day, and then after a week or 2 or even 3 weeks, if they're doing okay, then think about increasing it. If a patient's having side effects at a particular dose, it's pretty guaranteed that those side effects are going to worsen if the dose is increased. There is a dose response effect there. So it only makes sense to increase doses when patients are really able to tolerate the dose that they're currently on. And then I'll even sometimes do it more slowly. So start 1 capsule 3 times a day, and then only increase it by a capsule a day. So in other words, go 1-1-1 to 2-1-1 to 2-2-1, something along those lines, and really have a very drawn out dose escalation protocol. If side effects develop, the thing to do typically is try to return to the dose at which there were minimal or no side effects. So we try to not stop or interrupt the drug altogether. We try to bring the dose down to a tolerable level, and then slow down the dose escalation from there. If it needs to be stopped entirely, that obviously ought to be done.